Working with the quads is similar to the hamstrings, although the hamstrings tend to be a little bit more sensitive and persnickety. You oftentimes have to talk to them slower. The quads not quite as much, although they can still be a little bit jumpy and a little bit ticklish. Similar to the hamstrings, unless somebody is athletic, many people kind of have a big gluey mess for their quads and hamstrings. So while there really are 4 distinct muscles in the quads, a lot of times it's an undifferentiated kind of mass of fascia binding everything together. So one thing, as you start to feel the individual muscles and where they should be, one very useful activity in your compression and your friction and all your techniques is to start actually separating those muscles that should be separate. So with the quads, you have a big muscle on the top. You have a little teardrop that I'm sure you've seen on people with a lot of muscle and not a lot of fat. And then you have a big lateral one that has that iliotibial band running down the side that we looked at before. And then there's a deeper one, deep to the rectus femoris. So we have rectus femoris, vastus medialis is the teardrop, vastus lateralis takes up the entire lateral part with the pinstripe of the iliotibial band, about 2 fingers width at the around the knee. And then vastus intermedius being deep to rectus femoris. So, big strong muscles on the quads. You can generally use a bigger tool, like your whole hand with a good amount of strength on your heels of your hand. For some people, slower is going to work better. For some people, you can really kind of alternately compress and rock. It's nice because of the muscles wrapping around from the medial all the way to the lateral parts to vary your pressure to grab the different parts of the quads. And as you can see, as I start to get more lateral with them, this is one of those techniques where it feels really good to actually rotate the hip. So if I compress his quads on the lateral side, I can push his leg all the way in, and so if I hold that for a while, it's not only going to release the muscles here under my hands, but it's going to release and open up his whole hip. So anytime you're working with the legs, thighs, or feet, that you can actually rotate the whole leg up through the hip, that's very effective. Is that too much stretch or pressure? Okay. Now, when I'm pulling on the lateral side, sometimes I'll pull from across the table, or sometimes I'll kneel or otherwise get really low so that I can get all the way. This vastus lateralis actually goes all the way till the entire side and all the way here till starting in the back. So as I'm working it, I want to make sure that I get way out to the side. And as I hold his leg steady, medially rotated, I can really walk out and get those spots. Remember that kind of caution about the iliotibial band. In the middle of that vastus lateralis, right about the mid-stripe, if you had uniform pants with a stripe on them, or even soccer pants, the stripe will often fall right on the iliotibial band. So here's the knee about 3 to 4 inches proximal to the knee. If I move my thumbs anteriorly and posteriorly, I will find myself flipping over a 1 to 2 finger thick tendon that's very thick. And so that tendon gets too tight on a lot of folks. And if you just press quickly, hard, right directly on it, it'll often just hurt and make it sort of jump and not be very productive. So as you're reaching all the way to this vastus lateralis and getting the lateral part of his leg, you just want to make sure that you're not applying basically pokey direct pressure right on the IT band. So you can be behind it, you can be in front of it. In fact, isolating it from its structures that it gets stuck to is very useful. But by contrast, and I'm not going to do this to him in a way that hurts, but if I just went randomly quickly poking on the lateral side of his leg, I might accidentally press right into the tightest spot of the IT band, and it's painful. Most people are tender there. I can walk that basically all the way down to the lower legs. If you want to start really lifting the quads, sort of if you ever have wedged clay, like that wedging movement of clay that gets the air bubbles out, you can do movements that pull the medial lateral and the lateral medial. Now whatever tool you use kind of depends on what size works well for you. But like I could use my forearms to lift and press the tissue. I could use my palms. Of course, especially from about halfway up the thigh and up, you want to be very careful about not being too medial. It might feel vulnerable, it might be ticklish, or you might actually touch something you didn't want to touch. So the rectus femoris is shaped like this, and you don't really want to go medial into the adductors in the upper thigh, basically. So I can lift the tissue towards each other. I don't know if you can see this well because of pants, but right here I have a really nice wedge of tissue of the rectus femoris, and I can lift it off of the bone